Hi, Elliot Pierre here for Smith Saturdays. Brendan, today we have a question regarding the sciatic nerve. It comes in from Brita. So Brita's wondering if you can give her some information on what the sciatic nerve actually is and exercises that she could probably do to alleviate the pain in her lower back.
So, all right, back with Smith Saturdays. Thank you, Brita, for that question on the sciatic nerve. So, basic anatomy. The sciatic nerve is actually a combination of multiple nerve roots that come off from your upper lumbar spine, so just below your rib cage, all the way to your tailbone. So those nerves come together to make one massive fat nerve that can be the size of almost your thumb. Think about 5 different lanes forming together to make one big highway. What happens is when one of those nerve roots gets aggravated, either right at the source on your spine from a disc or a muscle pressing on it, or it gets entrapped, say, in between one of your glute muscles, aggravating one of that nerve, kind of like when you get an accident in a lane on a highway, slows down the nerve conduction and the amount of flow you get down your leg. This is why you'll get that sciatica, which is referred pain, tingling, numbness, burning down your leg. Depending on which nerve root you aggravate will depend on which part of your leg will get affected. Say nerve root number 2 or 3, you might feel it in the front of your thigh and your knee. Number 5, you might feel it down in the base of your foot into your toe. Asking about specific advice and exercises, you actually can't give very generic responses, and the reason for that is depending on how your tissues are naturally moving and aggravated determines what homework we give, which is where our assessments are so important. So if you're someone who a lot of sitting and bending flares you up, we give you advice on maybe some extension homework. But if you try to extend your back and it actually makes you worse, that's not going to be appropriate for you. So I will never give someone generic answers for exercise until we've actually looked at them. So if you do have some sciatic problems, please see your physio, your chiro, your massage therapist and get a little bit of advice. All right, guys, cheers. Thanks.